everyone, my name is Sarah Sun, and I'm your host for today's episode of Think with ABD. Here at Analytics by Design, we are passionate about driving the conversations that are shaping our future through the use of AI, technology, and design. Here in the year 2020, nothing has shaped our generation the way COVID-19 has, and will continue to do so for the foreseeable future. With that in mind, I have a very special guest for you today, where we will be talking about the intersection of COVID-19 and AI. I'm pleased to introduce Dr. James Hughes, an assistant professor, Ali Heaps Associate Chair, and D.W. James Chair Scholar at the St. Francis Xavier University. His interests include the development of artificial intelligence and machine learning algorithms for real-world applications. These include neuroinformatics, bioinformatics, kinematics, geology, art, finance, and clinical applications. Lately, his work has been focused around the development of vaccination strategies to minimize the impact of COVID-19. Welcome to the show, James.
Hey, how are you? Thank you very, very much for that intro.
James, why don't you start by telling us a little bit about your latest research?
All right. So from the intro, I'm really interested in applying AI to a variety of different applications. So when COVID-19 came along, it was just a perfect opportunity to start exploring this new problem in interesting new ways. And one of the first questions I get from anybody, because I'm a computer science professor, is what on earth does a computer scientist have to do with looking for vaccination strategies for a disease like COVID-19? And I suppose they're right. It does sound kind of silly, doesn't it? But we were kind of framing the question how vaccinating a population is actually a programming problem. Now, that it sounds weird, but hopefully throughout this, I'll kind of convince you that I'm not just being silly with my words. So the reality is, until we have an effective vaccine, which, we're all very, 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 very optimistic that it's going to be sooner rather than later, but at this time, we don't really have a timeline. And until we have that vaccine, it's going to be really, really hard to get back to normal, air quotes, back to normal, whatever that means. And just looking at the numbers in Canada recently creeping back up, people really want to get back to normal, but until we've got this vaccine, we can't really do that. Fortunately, we've got a little bit of time before a vaccine is available. And one of the big questions we're interested in is how can we find a clever way of applying vaccines to a population based on the structure and topology and shape of the social contact networks of a population to minimize the spread of the disease? So when the vaccine becomes available, we're probably going to have, hopefully not, but there's a good chance we're going to have a very limited supply at the start. And there's a number of reasons for this. There's going to be supply chain and logistics issues. There's going to be, there's time to manufacture, and we're competing with every other jurisdiction in the world to get our hands on these vaccines. So we want to find a clever way to apply these vaccines while minimizing the number of vaccines we're using to reduce the spread. I mean, if we have enough vaccines for everybody, this is an easy problem. Just to give the vaccine to everyone who wants one, and we're in really good shape. But if we can't do that, our hands are a little bit tied. So I want to be very clear, though, because before I start jumping into this, the CDC and the World Health Organization has a lot of metrics they use to decide how they should apply the vaccines to a population. And these metrics include things like risk-benefit analysis and demographic information and the values of populations, and logistical issues as well. But a lot of these things are focused on, these are all very, very important metrics, but our idea is to include another metric for them. We are not looking to replace any of these metrics, but we want to find another metric that they can use that guides their decision-making.
Very interesting. There's a lot of interesting things that you mentioned there as well. And so this idea of minimizing the number of vaccines that we're using, to me, this is an optimization problem.
Absolutely it is, yeah.
Okay. I'm going to save some of my other questions and give you a chance to really sort of jump into what it is that you're doing.
Okay, so we're using AI, but I'm going to get back to the AI bit a little bit. Now, I'm going to start sharing my screen. So We like to think in computer science and mathematics, we can sometimes represent a lot of different things with graphs or networks. And you're probably familiar with this idea, but just so everyone's on board, I'll give a little bit of a visualization here. So imagine this is you. This is an individual. We represent you as a circle. And maybe this is your household, okay? So maybe this is your partner, maybe you have 2 children or something, I don't know. And you're all connected to one another. So we draw these lines between each people, and we call these edges. And so we can show how individuals are connected. Now, obviously, this is a very small group, so maybe you have next door neighbors and it's just a couple, and maybe there's another set of neighbors down the street, and people in each other's households get together frequently enough that maybe there is a possibility of transmitting the disease. And maybe we can make this a little bit bigger. Maybe this is your workplace, and maybe this is one of your neighbor's workplace, and maybe we've got like the grocery store here. Maybe this is like someone that works at checkout, who's at that right by that groceries label. So we've got these nodes or vertices that are individuals, and we've got edges that, like the lines between the little circles, the nodes, that represent a possibility of the disease transmitting along that path. So now this is a very tiny little example, but it might give you an idea of what I mean in terms of this network. And I mean, we can make these networks as large as we want, although for compute, I know, right? So for the sake of computing, we'll probably keep these networks a little bit small, and for the sake of demonstration. But so here's our little network. So here's the big question. And here's an example of what I mean by using as few vaccines as possible to minimize the spread of the disease. So imagine we've got this situation, and I want to be very clear, this is a very idealized situation. So imagine this person on the fringe gets infected, and we decide to vaccinate this person here. Then, if that person gets vaccinated, we can protect everybody else. Because imagine this person on the right has they are completely connected to everyone else in this graph. Maybe they're a very popular person, they meet with a lot of people. Suddenly, because we've vaccinated this person in the center, we completely stop the spread of the disease. Now, this is a very, very, very idealized situation. This is the best case scenario. And the networks we have are a little bit more complex. Even the example that I was showing a second ago is even more complex, despite being small. So let's do a quick little example. Let's say I want to come up with a vaccination strategy that is based just on information about the structure and shape of this network. So this is what I mean by saying we're going to get additional information to give to the public health officials and decision makers to take into consideration when also looking at the World Health Organization and CDC's existing guidelines. So we are really just focusing on the structure of the graph. So imagine this is a really simple little vaccination strategy we have. And this is a common vaccination strategy a lot of people would come up with if you just ask someone, what's a clever idea that you could use? And it might be something like, well, if the degree of a given individual is greater than 6, apply a vaccine. And now, when I say degree, that's just the mathematician's way of saying the number of connections you have. So if the number of connections is greater than 6, then apply the vaccine. So let's do a quick little simulation. So hopefully you can see, but this little person just got vaccinated. Green, I guess, is vaccinated. And then let's say this person over on the side gets infected. The disease will spread. It's a random process, so it's not going to spread necessarily every iteration, or every day, or however units of time. But we can see that by vaccinating this one person, we effectively stop the spread of the disease from the rest of the network, which is wonderful. But of course, it also very much depends on starting conditions, because if this person up here gets infected, suddenly it's going to very quickly spread to the rest of the graph and our network. And we're going to see that it doesn't take very long for everybody who could get infected gets infected. So, not a bad strategy, but maybe it can be improved upon. Here's another strategy that says if the number of neighbors you have, so a neighbor is one of the individuals that you have a direct connection to. If the number of neighbors you have that are infected is more than 2, then apply a vaccine. And that kind of makes sense, right? Like if you come into contact with people who might have the disease, we'll vaccinate that person. And this, what you'll see here is this strategy is a little more interesting because it kind of reacts to the current state of the network and the epidemic in the network. So let's say this is our rule. Now, no one's infected yet, so no one gets vaccinated. But let's say we start with this individual up here getting vaccinated or getting infected, pardon me, and it's going to start to spread. And eventually we'll trigger that little program, that vaccination rule. So then we apply vaccines, and that means that, well, all those people that turn green get vaccinated, and suddenly we protected the whole population. Well, that's wonderful. But once again, it depends on the whole, like the starting conditions, right? So if we have that person that I was saying, like the checkout person at the grocery store, well, suddenly it's going to spread real fast before we start even vaccinating anybody. And the vaccines that we apply end up not being overly effective at reducing the spread of the disease. It helps, but it has its limitations.
Oh my goodness. But there's, like, even in this really simple example that you're showing us here, like the number of starting conditions is immense. It's absolutely immense, right?
Mm-hmm.
So how do you tackle that?
Well, the best we can do is we're going to do a whole bunch of different simulations with a whole bunch of different starting conditions. And over all the simulations we'll start to do our fancy statistics to learn a little bit more about how things work on average. But at the end of the day, it really, like, every case is going to be slightly different. So, I mean, what we're looking for, what we're hoping for is some magical silver bullet. That's not going to happen. I don't think it exists, but we're hoping that we find this magical strategy that just works wonderful in all situations. That's not going to work. We know that. I hope it does, but we're not expecting it.
If anything, what you've done for me already is, like, you've scared me into thinking that I should reconsider the size of my social bubble and start to really decrease it.
You know what? Based on the simulations, that's one of the best things you can do to minimize the spread of the disease.
Oh my goodness.
So you'll see with the slides I was showing, that's just the simulation of how things are spreading and different little strategies we can use. And if I ask anybody listening, like, come up with a strategy, I'm certain there are a lot of people that can come up with a lot of really good strategies that are probably really, really effective. So, but what should that program look like? If I ask everybody, and everyone might come up with a slightly different strategy, and they might all be reasonably good. But, if we go back to the original strategies we were talking about, maybe we should make the number of infected neighbors, because remember before it was number of infected neighbors was 2, maybe we should change it to 1. But if that happens, then we might run out of vaccines too fast. Or what if we combine the original 2 strategies we had, where if the number of neighbors infected is greater than 2, and their degree is greater than 6, then vaccinate. Or maybe we should find individuals that connect the clusters. Or maybe we should check if the total number of people infected in the community is more than 5, but the degree of the node is less than 8, and so on and so on and so on. But my point here is kind of like, we could play this game forever. We're just throwing ideas at the wall, and we hope that they work. But it's here. It's the search for these strategies where we're using AI and machine learning to help have the computer come up with its own strategies that are effective. And we like using AI because it's going to be a lot less laborious and a lot less guesswork on our part. It's going to be a lot quicker, and it will hopefully generate more intricate programs a little easier. And here's a big one that we're kind of really keen on is the AI won't be as biased by preconceived notions of what might be good or bad as a human. So the AI has ability to kind of think outside the box, which is kind of valuable. So the type of artificial intelligence we're using it's a beefy, computationally expensive type of AI called evolutionary algorithms. Specifically, I'm using something called genetic programming, which I think is a lot of fun. And when doing it, we ended up coming up with some really interesting solutions. This tree here, which is kind of hard to parse, which I kind of did for the sake of demonstration. I mean, I don't know about you, I wouldn't have come up with this. It's got some weird rules in there, like if the difference between 14, the number of neighbors infected, is greater than the degree of the node minus 8, then you should vaccinate. I mean, that's absurd if you ask me. And, once you think about it a little bit, it kind of starts to make sense, because this situation would say something like if we have this scenario here where we've got this poor individual that's connected to, how many do I have there? 1, 2, 3, 4, 6 individuals that are infected. The strategy that we came up with the AI would actually say, don't vaccinate this individual. And I mean, at first we didn't really think that made a lot of sense. We're thinking, well, this poor little node here they're doomed. But once you think about it, it kind of makes sense, because that person may already have been exposed to the disease. And remember, and this is an important point, which sounds kind of bad, but remember that the point is we want to minimize the number of vaccines used to also minimize the spread of the disease. Where you might remember that previous example where we used one vaccine to kind of protect everybody in the graph. Well, in this scenario, one vaccine could at most save one individual. That doesn't mean leave this person doomed. That means, for public health officials, that means, well, no, mobilize the resources we have already to help and support this individual. That might mean get them out of there right away, or maybe have them self-isolate. There's a lot of things it could mean. But in terms of these vaccination strategies we're coming up with, it was saying, don't vaccinate this individual. But I should say that the strategies that strategy I'd shown moments ago was on an earlier version of the software and tests, and things have changed just a little bit, but we're still getting some pretty interesting results so far.
Okay, let's back up. When I think about this research that you're doing, so first of all, what kind of a graph are you using to represent the population? Is your research focused in Canada or more globally?
Everything before today at this stage, we were using some random graphs, and we were picking these randomly generated graphs that have similar properties to what real social contact networks might look like. Now, we had to study a couple different types of them, because all of these random graphs have pros and cons between them. But we're finally starting to get our hands on some real world data. So we've got this little graph that actually represents a real social contact network. But I've got some colleagues also one's at the University of Guelph, one's at Brock University, but at University of Guelph, they were developing models based on the information from public health in Guelph and in Toronto to generate graphs that had similar properties to the graph that would have facilitated the disease parameters and spread numbers that existed in those places. So we have representative graphs there, but as time goes on, we're getting more and more information. For example, I've got an undergraduate honor student working with me who's studying some of these graphs that South Korea has made available. So up until today, we've been using synthetic data, because synthetic random graphs for testing and development purposes, but things are really starting to move and we're working on real data. And the interesting question is, do the vaccination strategies differ significantly? And how do they differ depending on the different types of graphs and topologies and shapes of these graphs?
Are you finding that they are differing a lot as you're experimenting with the data?
There are certain strategies that seem to be effective on multiple different types of graphs, but on the individual types, you might be able to get very specialized vaccination strategies that could help that particular type of graph. And even just how connected the graphs are. So if you think of graphs where the average distance between any individual is low and the degree is high, so you've got these really dense graphs, the vaccination strategies are going to be wildly different than if you have less dense graphs that are less connected, but perhaps it's harder to connect two individuals, like the distance between any two individuals is a little higher. So that might be like a friend of a friend of a friend of mine versus oh, I know everybody in town, So depending on these properties, we are getting slightly different results, and sometimes quite significantly different results.
I guess that just makes it even more important that you actually start to see some real world data, right? Eliminate some of the bias that goes into it.
What we were really hoping we could do is get our hands on amazing data from everyone's local town, and we get these tailor-made vaccination strategies for maybe Toronto, and then one for Mississauga, then one for Hamilton or something. But realistically, we're not going to get our hands on that data. We're crossing our fingers that maybe we can get some cell phone data from some organization, but that's like future problems for us. We're still in a little bit of the development stage, but things are moving.
Another question that I had for you is, are you taking into any assumptions like the time to vaccinate? Because I think like the minute the vaccinations land in Canada, there's no way we're going to vaccinate everyone that needs to be vaccinated according to a strategy within a certain amount of time. So like, how does that wreak havoc with your programming?
That is one of the key things in our simulations that we were playing with. So one of the parameters we have is how often do we get vaccines? Because maybe we get a shipment once a week. Maybe it's every other day. Maybe it's once every other week. I don't know. But these are values that we can tweak and play with to come up with different strategies depending on the situation. So right now in the test I was doing, I was just playing with some parameters saying, let's assume we get a shipment of vaccines once a week. So we can only apply vaccines like once a week. And we get a very limited supply of vaccines. Like we could only, at any given day, we could only vaccinate a small proportion of the population. But as weeks go on, we'll be able to vaccinate more and more and more people.
Oh, very neat. Tricky.
Yeah, these were all the,
tricky.
Yeah, we wanted to make sure we parameterized as much as we could to account for the complexities of our current situation. But once you start doing that, just the complexity starts to grow and grow and grow. So we have to kind of play that balancing game of capturing as much information as we can to get as accurate as a model as possible. But one of the goals is to hand this technology off to government officials and public health decision makers. So it needs to be accessible for those individuals as well.
Okay. So then I would love to learn a little more about these, the evolutionary algorithms or the genetic programming as you talked about. Like, so is this a relatively new field, or like what sparked your interest in it?
So evolutionary algorithms have been around for a very, very, very long time, at least even in terms of their proposed idea of existing. Some of the earliest forms of AI kind of had this idea to it. But different implementations and as you know, when rubber meets the road, different kind of strategies came up. And the one I was using, genetic programming, came about late 80s, early 90s. And it was popular, but never became overwhelmingly popular. But I got really interested in these types of algorithms. I'm not really sure why. I just had I learned them and thought, hey, this is kind of neat. And I started learning these things during my undergrad, so it's been a little while. And yeah, so it's funny, when I started going to grad school, actually before going to graduate school, when I was looking for a supervisor for my honors thesis, I went around and met all the professors in my department and thought like, oh, we'll do research. And I met a couple, and at the end of the day, I ended up going with the individual that just kind of sold their research the best. And that's how I got onto the road to where I am today. And I often think back, like, what would have happened if I went and worked with a different researcher that worked on something remarkably different? But anyway.
That's so funny.
Yeah.
So the genetic programming, so it's interesting. I mean, I guess there's so many algorithms that have been around since that same time period, but it's only really in the last decade, really, have we been able to maybe try out these examples in the given, GPUs and the cost of computing and everything. What algorithms are there other algorithms that you try this against? Like, how does this compare to some of the more popular ones that the industries are using, like neural nets, deep learning, that sort of idea?
So you're absolutely right about these technologies becoming more and more feasible as computing power goes. And evolutionary computation in the recent years, especially when you look at Uber, has really kind of taken off again. But compared to things like, a lot of people are familiar with artificial neural networks. And although it might be possible to harness an artificial neural network to do the type of work that we're doing, and I would encourage anybody to try this if they could. But one of the key things that we were looking for is when we come up with a vaccination strategy, we want it to be something very explainable. We want it to be something we can point to and say, here's the vaccination strategy, here's why it's good, and it's clean, we can look at it, and it's intuitive. And unfortunately, with neural networks, a lot of times the results are kind of very difficult to interpret, if not entirely impossible to interpret. So they're very black boxy, where evolutionary algorithms, specifically the genetic programming, it creates very easily interpretable little functions that we can look at. Kind of in like the examples I was showing moments ago, they really do give us little programs. So genetic programming is kind of it sounds really crazy when you explain it to people, but here's the idea and how it works. Imagine you've got a problem you want to solve. You've got a problem you want to write a program to solve, but the problem that you're trying to solve, it's really complex, just, kind of like vaccinating a population. So you don't really know what the program should look like. You might have some ideas and you know what a good program is. So how about this? Let's try this. Let's generate thousands and thousands of randomly generated programs and test them out on if we're generating vaccination strategies, let's run some simulations and test how good each one is. They're going to be horrible when we start. They're not going to be very good at all. But some might be less horrible than others. I say less horrible because they're probably still pretty terrible, but less horrible. So imagine from these thousands and thousands, we call this a population. Imagine if we take the relatively good ones in there and let them, quote unquote, breed with one another and generate offspring that are similar but have changes. And then we keep doing this until we generate a new population. So we have thousands and thousands of new ones. And then we just repeat this process. We do the simulations, we pick the good ones, we let them breed, create another population, evaluate them, simulate, pick the good ones, do this hundreds, thousands, millions of times. And after you do this, you end up with pretty good functions at the end. You end up getting pretty decent results. The benefit of this is I'm taken out of the equation. The AI, through this very natural process that we're trying to simulate evolution, will come up with really interesting, clever, novel solutions like the ones we were finding that we were just talking about and that we're finding today. So we really like genetic programming for this because it comes up with a really nice, we'll say like symbolic answer that we can look at. There are a whole bunch of other types of AI. And the plan is at this stage, I've got one of my colleagues who are using genetic algorithms, which is another type of evolutionary computation, to come up with strategies as well. But the plan from the beginning is to incorporate other forms of artificial intelligence. The software has been designed in such a way that it's kind of like it's intended to be plug and play, where you can just plug in your AI algorithm and run the simulations and you can contribute. And that's kind of our goal. We've put our software up on GitHub and we would love anybody to have access to it and just try what they can do. At the end of the day, we're a small research team and we would love to have anybody and everybody working on this, because if that happens, we can end up with probably much clever and better solutions.
James, that's amazing. My next question was going to ask if there's like a way for people to get involved or learn more about genetic programming from an open source perspective. I wonder if there are other industries that desperately need the kind of open transparency that these strategies require in so many other applications. I do believe that the black box nature of a lot of advanced AI right now is a major deterrent for many people to actually be able to pursue a little bit more seriously. So that is very neat.
If you look at anything from like a clinical setting, if you can't explain why the decision, no one's going to use the technology, for better or worse.
Yeah. Okay. I'm going to switch gears a little bit. Mike, I would love to ask you some of the ethical implications of the research that you're doing.
Yeah, there are a number, and we actually did spend some time kind of thinking of these things. So there are a lot of things that we could consider. And some of these questions that we could talk about are not specific to this particular project, but really is relevant to AI practitioners in general and how we use the data and what the results we get really mean. with the technology we've built so far, we got to be clear, this is version 0.1, you know, like it's a very early version, and we've got a lot of plans to make this beefier. We've got a lot of plans to incorporate a lot more information. And some of the information we would love to incorporate based on census data is demographic information, because certain diseases might have different rates of spread and different different infection rates, different incubation periods, different recovery times for different groups of people. So imagine you've got this AI that ends up kind of ignoring particularly at-risk groups because, well, you know, there's no real chance in protecting them. The AI might come up with a solution like that, which is, of course, horrible, absolutely horrible. And we need to be really careful, because if we're not really paying attention to the results we get, this could very well happen. So that particular example comes up once we incorporate some of the demographic information. But as of right now, it might also come up with a solution that kind of says, you know, if you've got maybe a portion of the social contact network that's kind of off to the side, isn't very well connected, you can kind of visualize this as maybe a more rural community. And the AI might say, you know what, don't bother vaccinating them, because, you know, the chances of the disease getting there is low. And if it does get there, because it's so not connected, it's probably not gonna spread too quickly in that area. But, you know, if we take a second to think about rural populations in Canada, we might start to think like, well, no, that's not okay. Maybe the infrastructure in those locations, in those rural areas, are absolutely horrible. Or maybe these groups are from historically discriminated against peoples that are now, I mean, the optics of saying like, oh, don't go vaccinate these people because, oh, you know, they're not at risk of getting it anyways. I mean, absolutely not. That is horrible. You can't, like, that is not a good idea at all. So, but I mean, both ethically and politically. Other things that can come up, like, you know, I mean, the research is changing every other day. But when we talk about like children, you know, susceptibility levels and severity levels, imagine the strategies say like, oh, don't bother vaccinating kids, whatever. Yeah, good luck trying to sell that to a population, right? Like, I'm pretty sure that is like the antithesis of a good idea for a politician.
Yeah. Oh my goodness. I could just imagine. As I view your social networks too, and watching the disease spread as well, I can't help but feel that, especially in Ontario in the last few weeks, we've gotten a few articles about how there's like super spreader events, you know, weddings, baby showers, and there's groups that are breaking the rules right now. And so if we're going to vaccinate those with the highest degrees, obviously I think that takes into account like frontline workers, et cetera, people who are genuinely out there, but you're also kind of grouping a few of those troublemakers in there too. And the optics of that are interesting.
Oh man, that's a really good point, because if you've got these, let's say, you know, troublemakers, you know, in italics, that are maybe breaking the rules and they come into contact with a lot of people, if the vaccination strategy says vaccinate them, yeah, absolutely, that's going to have horrible optics.
then it makes me sit here and wonder, like, well, if I want this vaccination, I should have been out there, you know,
yeah, I should have been
way more
breaking
often,
the
right?
rules. Oh man, oh, that's a nightmare can of worms. That, oh my goodness. But imagine that. Imagine it comes back saying, you know what, though, at the end of the day, this will reduce the spread throughout the population on a whole. But, oh man, people are going to be very unhappy if it comes back with something like that. You're right.
So funny. Really, really interesting. Well, James, what's next for you in your research right now?
We're really excited to get our hands on some real world data. And this has been kind of in the works for a little while. So finally, we got the data today. Literally moments before this call started, actually, I saw the email from my colleagues. So I got really excited. So we're working with these real graphs, and we're also generating these graphs that represent real real spreads in different municipalities like Guelph and Toronto. But one of the things that we'd like to talk about in our research group is to continue the discussion about the ethics around this type of stuff. Like, you brought up a really good point here today. So there's a lot to talk about. And we really are planning on incorporating other forms of AI. So not just genetic programming, but maybe different, simpler for lack of better term, simpler forms of artificial intelligence and machine learning, like maybe something like a decision tree might be very effective here. We are also working on a new epidemic model that hopefully captures a little bit more information about COVID. So in the figures I was showing earlier, that kind of represents like infected individuals and susceptible individuals, which that's not even what we're using in our simulations. We're using the SEIR, which susceptible, exposed, infectious, and removed. That's been popular for COVID research, but it kind of ignores some of the interesting properties of COVID. So we're developing a model that more accurately represents reality. We're looking at different graph measures we could include. So things like, you know, the graph measures were how many neighbors do you have that are infected? So we can make that list longer and longer and longer. I mean, the list goes on forever. I've got two research students, one's a graduate student, one's an undergraduate honors student working on their thesis. And the task I've given them at this stage is just, here's the software, play with it for a month. And you're gonna come up with 1,001 different ideas while playing with it. And 1,001 of those ideas are probably gonna be good ideas to potentially explore and continue. And I think that's one of the better ways to come up with interesting novel ideas, is just by getting this into the hands of as many people as possible. We're currently in the process of developing a website that kind of becomes like a central hub where we host different data sets of real world stuff. We want to host also particularly effective strategies for given graphs networks as well. So people can kind of, maybe even if they're contributing, maybe they can submit their own functions, and then we can evaluate them and be like, oh, wow, you found the best possible function for this particular type of graph. Like that's wonderful. So that's in the works as well, but there's a lot of things moving. We've got a lot of other grants out there trying to get more resources to fund different aspects of this project, because this project can go on in so many different locations. So really, sky's the limit. And it's kind of scary to think how many interesting ideas and fun new avenues to take in research when you place it against the backdrop of something as serious as COVID-19.
That's crazy. Your work is cut out for you, but I love that idea of being kind of like crowdfunding the vaccination strategy a little bit. There's some really cool ideas you've got in there.
We hope it takes off, yeah.
Well, that's all the time we have for today, James. That was absolutely fascinating. You're going to have to send me some links to learn more, and some research that we can share with our users, because I know that they're going to be clamoring for some of that information. But thank you so much for joining me today, and we really appreciate you joining us here at ABD.
Well, thanks for having me, and I had a lot of fun.
Oh, good. Take care, James.
All right. Have a good one.
Comments, views, and opinions expressed in this podcast do not constitute as business or investment advice. Comments mentioned by podcast participants are solely their own and do not reflect the views of Analytics by Design and its constituents. Thanks so much for joining me today. I'm Sarah Sun, and stay curious.